All right, good afternoon, everyone. Today I would like to welcome you to the 2018-2019 Influenza Kickoff Press Conference. Today you'll hear from the North Dakota Department of Health, Bismarck-Burleigh Public Health, and a coach from the Bismarck-Synchro Skating team. We will all discuss and reinforce the idea of how important it is to prevent influenza through vaccination. We will conclude the press conference by welcoming two members of the Capital Ice Crystals to be vaccinated on camera. So today I would like to introduce my very first speaker, Jill Baber, who is the Respiratory and Syndromic Surveillance Epidemiologist from the North Dakota Department of Health.
Thank you, Abby. Thank you all for coming. We're here to talk about influenza, of course, so I'm just going to talk a little bit about what influenza is and what it looks like in North Dakota. Influenza is a common respiratory illness that is spread through coughs and sneezes, touching contaminated surfaces, and touching saliva, which is kind of grody. The presentation of influenza can be mild to deadly. So we use vaccines to protect us against influenza because influenza can have a major impact not only in North Dakota, but worldwide. The influenza season in North Dakota runs from October to May, with most of our cases happening between January and March. However, influenza can be very unpredictable. Last season, we saw the start of the season in November, so it's good to get vaccinated probably before the end of October, something I'm sure Abby is going to talk about as well. We want to echo that before the end of October. Last season was the most severe season we've had on record since the pandemic. We saw a total of 8,530 laboratory confirmed cases in North Dakota. That is just people that had a laboratory confirmed disease. So if people went to the doctor and got diagnosed without a test, they're not included in that number. It's more just to give us the idea that it's a lot of cases. We hope this season will be more mild than last season, of course. Really hope that. But of course, it's unpredictable, so we don't know quite what will come. So we're here to talk about how to prevent influenza. So whatever happens, you guys are protected. There are several ways people can prevent influenza, or at least lessen the disease in their bodies. The first is vaccination. The second is good hand washing etiquette. That one's really important too, to prevent a lot of other respiratory diseases that the influenza vaccine does not protect against. Staying home when you're sick is also important, as well as covering your coughs and sneezes and taking your antivirals if they're given to you by a doctor. So to talk more about influenza vaccination, I'm going to bring Abby Berg back. Abby is the Vaccines for Children Manager with the North Dakota Department of Health, and she's going to talk a lot more about influenza vaccination.
Oops. Thanks, Jill. So getting the influenza vaccine is really your best way to reduce your chance of getting ill and also passing that virus or that illness on to your friends. The flu vaccine recommendations are pretty simple. It's recommended for everyone 6 months of age and older. However, there are individuals who are at high risk for complications. Those people would be children between the ages of 6 months and 4 years, adults over age 50, pregnant women, as the vaccine can actually protect both the mom and the baby, people of any age who have a chronic illness or compromised immune system, American Indians and Alaskan Natives. It's also particularly important for people who are in contact with those high-risk groups. So you yourself may be healthy or not have one of those conditions, but you may have a household contact who has a high-risk condition, is pregnant or elderly. So it's really important for you also to protect those members of your family. The flu shot can also keep you healthy and active, so it can keep you from getting sick and having to miss school, work, sports, or other activities. And like I said before, you should not only get the flu shot for yourself, but for everyone around you to protect those people. The flu vaccine is not 100% effective, but it can protect against severe complications from the flu. So unfortunately, every year we do see healthy people who get influenza and have very severe complications. So it's important to think that even if you get your flu shot and you do come down with the flu, you're generally not going to suffer from those severe complications. So for the 2017-2018 influenza season, which was this past influenza season, about 48% of children ages 6 months to 4 years were vaccinated. So obviously that number is lower than we'd like to see it. About 53% of adults 65 and older were vaccinated. And our lowest age group was adults aged 18 to 49 years at 19%. So obviously we would like to see a lot of improvement in those numbers. Overall influenza vaccine effectiveness for last season was about 40%, which is not fantastic, but it's still something. This means that the flu vaccine reduced a person's overall risk of having to seek medical care at a doctor's office for flu illness by about 40%. CDC recommends, as Jill said, that everyone be vaccinated before the end of October if possible. However, it's never too late. So if you're in your doctor's office in January, you can certainly be vaccinated at that point. There are many different places you can receive your flu vaccine, such as your local public health unit like Bismarck-Burleigh, who we have here today, your primary healthcare provider, or your pharmacist. So with that, I would like to turn it over to Naomi Fries, who is a nurse from Bismarck-Burleigh and who will be vaccinating our team members today.
Thanks, Abby. Yes, I'm Naomi with Bismarck-Burleigh Public Health. Glad to be here today. Glad we're kicking off with an awesome group of I'm thinking just young ladies and some of their family members. Things that we, really want to try to stress is that we do flu shots, in our clinic by appointment. We're starting to take appointments now. We give them other times through other, not necessarily just the flu clinics. And so if you're coming in for something else, and you're wanting your flu shot, we can certainly do that at the same time. We are also seen running throughout Bismarck because there are a number of different businesses that contact us to come into their agency to do flu shots. And so we do a lot of those. And so we keep busy trying to keep the people healthy. And I know one thing that I can't remember if Abby and Jill said that or not. There are certain groups, of course, that cannot get the flu shot. One of them being the newborns. There is, newborns through 6 months are not able to be vaccinated yet. So that's why it's really, really important that family members come and get that flu shot to protect that baby, because they are at high risk of becoming very ill with influenza. And then unfortunately, healthy people get very sick with influenza, and healthy people do die from influenza. And so we hear, oh, I'm healthy, I can tolerate it, I won't get the flu shot. Well, we know unfortunately that works for a majority of people, but some people do get sick and actually pass away from it too. So that's why we're really pushers of the vaccine. So thank you.
And next, we'll bring up our coach, Becky Gallion.
Hi, thank you so much for coming today, and thank you to you guys for doing this for us right at the rink, so our skaters have no excuse to not get the flu shot since they can just get right off the ice and do it. A couple of years ago, we had an incident at Nationals where many of our skaters came down with the flu while at Nationals. Luckily, we were able to pull through, and everyone was able to compete, but it was a scary experience and lots of uncertainty whether we would have put in all this work and not be able to get on the ice at the end of the year. This last year, we had majority of our team members get the flu shot, and thankfully we had a much healthier Nationals with no one getting the flu while we were there and everyone able to get on the ice. I just want to thank you all for doing this, and thanks.
Okay, so now we're going to have our 2 ice skating members come on up, and we'll have Naomi from Bismarck-Burleigh vaccinate.
You can choose which arm you prefer, okay? Just in case it gets a little bit achy, okay? That's not uncommon. Which arm? Right arm. Okay, good. That's good. That's good.
Okay, thank you to Addison McKinty and Emmy Miller. Thank you very much. You guys were troopers. Let's give them a round of applause. All right, and so now we'll ask if anyone has any questions for any member of the speaking panel. Is there anyone on the phone who has questions? Or anyone in the room? Okay, it doesn't appear we have any questions, so that will conclude our press conference. Thank you all for coming.